At least 26,000 Americans now diagnosed with COVID-19, with the epicenter of this crisis, New York City, hours away from the state's stay-at-home order. Governor Cuomo's warning to the young and healthy.
You're not Superman, and you're not Superwoman. You can get this virus.
The nation's tourist attractions deserted, stores boarded up, and the virus even forcing a ground stop at one of the nation's busiest airports.
The battle at the hospitals, fighting the virus and the lack of supplies. Medical workers sounding the alarm. Private businesses now answering the call, how they're pitching in to provide.
Supply and demand. The White House responding to the urgent need for more masks.
When exactly can they expect to receive these masks, though?
We'll prioritize.
The president's press.
We make
masks start coming in.
And how they'll be distributed across the country.
Fighting the pandemic. Researchers around the globe scrambling for a treatment this morning. A new approach. Will shifting the focus be the key to a cure?
And home court advantage. The athletes showing off their skills all through the house. How they're rolling on and still making baskets to make the best of their situation.
Live from ABC News in New York, this is Good Morning America.
Hey, good morning. As you can see, Whit is not on the desk with us this morning, but we're going to hear from him in just a moment. First, though, let's dive right into the latest on the coronavirus pandemic. Now hitting our coasts especially hard. Here are the latest numbers. Overnight, cases of COVID-19 surpassed 300,000 worldwide, with nearly 13,000 deaths. Here in the U.S., the numbers are soaring, more than 26,000 cases and 340 deaths.
The epicenter in the U.S. is now clearly New York, with more than 12,000 cases, most of them here in New York City. Most are between the ages of 18 and 49. And by tonight, New York State's 19 million residents will be under a stay-at-home order. We have team coverage of this global crisis with ABC's Stephanie Ramos in Times Square, Mona Kosar Abdi at Mount Sinai Hospital in New York, Trevor Alt at the White House, and Julia McFarlane in London. We begin, though, with Stephanie Ramos. Good morning to you, Stephanie.
Eva, good morning. New York City's Times Square is cleared out, and that is exactly what the mayor and governor of New York want to see. People staying home, especially now that nearly 100 people have died here in New York due to the coronavirus.
Coronavirus cases in New York State exploding. At least 11,000 New Yorkers diagnosed with the virus. More than half of those cases in New York City, what officials now consider the epicenter of the pandemic in America.
I know people want to hear it's only going to be a matter of weeks and then everything's going to be fine. I believe it is going to be a matter of months.
New York conducting more tests than any other state. The governor announcing new numbers showing more than half of the state's COVID-19 patients are between the ages of 18 to 49, reminding the young they are not immune.
You're not Superman, and you're not Superwoman. You can get this virus.
Governor Cuomo adding that 4 sites here are on the Army Corps of Engineers' initial list of temporary hospitals. This as an air traffic control trainee tested positive for COVID-19, causing a ground stop at JFK Airport and Philadelphia International. Americans urged not to travel unless necessary. New York's stay-at-home order taking effect tonight as neighboring New Jersey joins in, canceling gatherings, ordering residents to do their part and stay home.
We're at war, if that is not apparent already. Any place people congregate is a place where coronavirus can be spread.
The Garden State, the latest to join states like Illinois, Nevada, and California in ordering residents to stay home to slow the spread of COVID-19.
Every American has a role to play in defending our nation from this invisible, horrible enemy. So we say stay at home and save lives.
In California, outside of LA, health officials trying to slow the spread of the virus this weekend by hosting drive-through testing to limit human contact. Most Americans hunkering down, grappling with a new reality. Tourist attractions across the country deserted. In LA, the iconic Grauman's Chinese Theater empty.
I'm not sure if you've heard yet, but we are closing after today.
Businesses boarding up from Texas to New York, uncertain when they'll reopen their doors as millions of Americans prepare to file for unemployment.
When you have no idea how long that will be, how can you predict if you will make it?
And we're now learning that Hawaii's governor has put in place a 14-day self-quarantine for anyone traveling into the state as part of their efforts to fight the virus. Eva.
All right, thank you, Stephanie Ramos. And on the front lines of this, medical workers in emergency rooms and hospitals that are already on the verge of being overwhelmed. ABC's Mona Kosar-Abdi is outside of Mount Sinai Hospital in New York City with more. Good morning to you, Mona.
And good morning to you, Eva. Experts say the most surprising part in all of this is the drastic surge in patients that have fallen ill from the coronavirus. And at this rate, medical professionals say it's only a matter of time before they run out of essential supplies.
This morning, some doctors sounding the alarm as the number of confirmed coronavirus cases grows by the hour.
Even over the past day or two, we're seeing a real increase in the acuity, the seriousness of patients coming in.
The influx of patients growing in Boston. Emergency doctors at Mass General Hospital seeing a big change. Doctors there are concerned about running out of beds. It's a concern in New York as well, where, like Boston, physicians are seeing more and more young people seriously ill.
There are a significant number of people under 50 who have required intubation and have required admission to the hospital. And so don't want anybody to think that just because you're young and you don't have any medical problems that you're somehow immune to this. Or superhuman.
As the disease spreads, nurses and doctors say they don't have enough supplies to take care of their patients. They need more now.
We are the United States of America. We should not have to be in a position where we have people die simply because we don't have adequate supplies or adequate beds or adequate workforce.
Across the nation, lawmakers making efforts to provide the needed equipment. Officials in New York purchasing more than 2 million new masks and 6,000 ventilators. The city now limiting testing for COVID-19 to patients who have already been hospitalized. But officials warn that may not be enough.
This is concerning because without those, we can't do some of the more common life-saving things we normally do in the emergency department, like intubation, CPR, other things, without a significant risk to us healthcare workers.
Now the federal government asking people and businesses to donate any equipment they have. Apple sending millions of N95 masks to hospitals, Hanes stepping in to make masks, and Tesla donating equipment that could be used for ventilators. While Brian Shipp of Sons Recycling pitches in too, their business donating tens of thousands to retirement homes as well.
The director of the nursing home was in tears. She was so excited to get them.
And officials say due to blood drives being canceled, they're in desperate need of donations. So if you would like to help, they suggest going to the Red Cross website or reaching out to your local blood bank. Dan?
A great idea, Mona. Thank you. Just moments ago, I spoke with Dr. Jolien McGreevy, the medical director of the emergency department at Mount Sinai Hospital right here in New York. Dr. McGreevy, thank you very much for joining us, and thank you for all the work you and your team are doing.
Thank you for having me.
So, as I mentioned on the air yesterday, my wife is a former ICU doctor, intensive care doctor here in New York City, and she and I have been in touch with doctors on the front lines throughout the city, and what we're hearing is really bracing. We're hearing quotes like, the situation is insane, it's like a tsunami forming over us, it's a national catastrophe, we're hearing about a lack of supplies, doctors getting sick. What is the situation like for you and your team?
So I would say, thankfully, we're doing better than that. We're certainly prepared for this thing to get worse and what the next steps are going to be. But at the moment, we're doing OK.
Do you worry about not having enough supplies to protect your staff and then, as a consequence, to protect the rest of the patients?
Yeah, so it's not really at the front of my mind. I'm not worried about that. I think the thing that I'm more worried about, is making sure that people are really following all the precautions of the public health authorities and trying to stay home if they have mild symptoms, if they have no symptoms, really to just sort of stay home and take care of themselves. That's probably the most important thing.
Let me ask you finally, there's now a lot of talk that one of the ways we're going to get through this is to scale up our capacity for intensive care across the country, building new hospital beds, possibly bringing in ships that can anchor off the coast and we can have hospital beds there. But working in an intensive care unit for the doctors, the nurses, and the rest of the staff requires really specific skills. So how prepared are we as a country to scale up intensive care?
I've been surprised at the ways in which people have been able to expand sort of the skills that they use on a daily basis. I think we have enough critical care capacity, certainly enough emergency medicine capacity. I think some of these other folks, really can serve a lot of other roles, taking care of people to sort of offload those who are really needed to provide that critical care. That's probably the most effective, and that's certainly what we're seeing.
I just want to, on a personal note, again, thank you, but also to just check in and take your temperature and see how you're feeling as we head into an extremely busy, to put it mildly, period.
Yeah, on the whole, I would say I'm feeling inspired, just being able to watch the stuff that my colleagues are doing. It's absolutely incredible, I think what people have done over the last month. We know there's at least a month or more ahead that's going to be pretty tough, but I think healthcare workers are taking care of each other so that they can take good care of the patients, and it's really wonderful to see.
I will agree with that. It is wonderful to see. And again, I want to thank you and your team for all the work you're doing. Thank you very much, Dr. McGreevy.
Thank you so much.
And we can't thank those healthcare professionals enough for what they're doing right now. From the questions of basic medical equipment to the availability of tests, the Trump administration continues to face questions about its handling of this crisis. ABC's Trevor Ault has more now from the White House. Good morning, Trevor.
Eva, good morning. It's really a critical day here in Washington, and time is of the essence. The final negotiations are expected on that $1 trillion stimulus package as the president and his task force say they are trying to support our healthcare workers who are being pushed to the limit.
As America's healthcare system faces unprecedented strain and alarmingly depleted supplies, the president's coronavirus task force has announced they're making massive purchases to try to meet demand.
HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA.
That's $500 million in medical masks spread out over the next year and a half, though the task force didn't give a timeline for exactly when those masks will be delivered to the nurses and doctors who so desperately need them.
When exactly can they expect to receive these masks, though?
We'll prioritize those scarce resources because every single governor across the country is looking for the exact same things.
Even the president jumping in to ask the task force for a direct answer.
When will the masks start coming in?
They're out there now. So again, we want to match. We want to get out of the middle, I think.
I appreciate it. Yeah, that's what I like to know. When will the
so we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
The president also continues to tout a medicinal pairing that he says could be one of the biggest game changers in the history of medicine: malaria drug hydroxychloroquine and antibiotic azithromycin, which don't have FDA approval for use against the virus.
Right now, this to me would be the greatest thing that could happen. This would be a gift from heaven. This would be a gift from God if it works.
Dr. Anthony Fauci said the president is trying to be hopeful, though he made a point to clarify neither drug has undergone necessary testing for recommended use. The FDA also confirming a new rapid test for COVID-19 will be available at the end of the month, providing results in 45 minutes instead of days.
Now, overnight, we did learn the vice president and his wife tested negative for COVID-19. They were given the test after a member of the vice president's staff tested positive. As far as the negotiations for the stimulus package, those are scheduled to resume this morning at 11. Dan?
Glad to hear the vice president tested negative. Thank you very much, Trevor. Really appreciate that. Let's bring in ABC's Martha Raddatz, who's going to be hosting This Week later this morning from Washington. Martha, good morning. As you heard in Trevor's piece, government officials say they're now making moves to address the lack of supplies, including masks. But can they move fast enough to avert a catastrophe where doctors and nurses start getting sick and can no longer treat patients? A problem that I happen to know has already begun.
Exactly, Dan, and your very eloquent interview with Dr. McGreevy. It's heartening to see a doctor feeling positive about things, but you have heard those stories from other doctors. I have heard those stories from other doctors. There is an urgent need to get these medical masks, these ventilators to hospitals right now. There's already guidance being discussed about what they do in these hospitals if they don't get them in time, how they adapt if they don't get their urgent needs met. I loved seeing Trevor Alt there pushing that task force on when those masks would be distributed, when they would be delivered, but he got no answer. Even President Trump didn't get an answer.
As speaking of Trevor, we saw him reporting there that Congress seems to be on the cusp of passing this massive stimulus plan. A lot of us are worried about the economy. Can a stimulus like this help, given that the economy has essentially gone into a deep freeze?
Well, it certainly would help in the short term. I think the bigger question is long term, what do they do? We still have no idea really how long this might last. I think we'll get a better indication of that in the next 2 or 3 weeks. But if this is long term, month after month after month, we know the president has said there might be another check, but we'll have to see that. And that is really an urgent need as well. You've got a health crisis, you've got an economic crisis, and both need to be solved.
Exactly right. Martha Raddatz, we really appreciate your insight on a Sunday morning. Thank you very much. I want to remind everybody to tune into This Week later this morning. Martha's going to go one-on-one with FEMA Administrator Pete Gaynor, plus New Jersey Governor Phil Murphy and Michigan Governor Gretchen Whitmer join Martha to discuss how their states are responding to this crisis. That's all coming up on This Week. And while I have you, I also want to remind you that for the latest on all the news in this busy time, tune into our new streaming service, ABC News Live.
Well, you may have noticed Whit Johnson isn't in his regular seat with us this morning. He happens to be home today because he came in contact with someone who has tested positive for coronavirus. And Whit tells us that he feels fine. He's joining us live from his home this morning. What's the story?
Well, Eva, I feel like Papa Dan put me on a bit of a timeout this morning. So, but I'm here. Want to make clear that I'm feeling fine. I have no symptoms whatsoever. But we learned yesterday that I interviewed someone recently who has since tested positive for COVID-19. And this has been the protocol. If you come in contact with somebody who tests positive, you're supposed to self-isolate. It also happened to fall within that 14-day window. So we're working with management and our medical team to just sort out exactly how long I should stay in this self-isolation. But it's the right thing to do. It's an important thing to do. I'm not feeling anything whatsoever. My wife, my kids, we all feel fine. But just out of an abundance of caution, I am here in my living room talking to you.
You are doing the right thing, and we're all glad that you're feeling okay. Although I will say on a selfish note, we miss you. The show is not the same without you. But one last question before we let you go. You are not getting tested, and there's a good reason for that.
Dan, we've been talking about the shortages of supplies and testing kits and materials. Yesterday, Governor Cuomo and Mayor de Blasio made very clear that if you are not feeling symptoms, they want you to stay home and act as if you are positive. So that's what I'm doing. We don't want to strain those resources. They are prioritizing right now. They want to test first people who are hospitalized and feeling symptoms and came in contact with somebody. They also want to test healthcare workers who are on the front lines, and then people who are older and may have underlying health issues. So I am here, feeling fine, and we'll see when I can come back and join you there in the studio.
All right, Whit, thank you very much. Hey, before we let you go, you want to do the honors and send it over to Rob for the weather?
Oh, yes. That's right. Our senior meteorologist, Robert Marciano, who I know is especially agonizing that I'm not sitting right next to him today. Rob, how's the weather going out there?
Not true, Joe Whit. And by the way, I love how you think that Dan has all power here, but we're going to wait for the timeout clear from your doctors and the medical officials. Thanks so much, buddy. All right, it's good to see him, but we do miss our boy Whit, and we want to keep everybody safe, as we do. And on the weather front, a little bit of severe weather coming in the next few days, but nothing we can't handle here. Some rain across the southeast, and look at this, some snow expected across the northeast, and maybe Chicago, Detroit, into parts of the northeast where we have winter storm watches posted. Springfield north into say, Brattleboro, Vermont. Later tomorrow, looking for rain, maybe some thunder and lightning across parts of Nashville, and then snow starting out to get the kids at home excited in the metro areas, and then turning over to rain, but we'll see accumulations, I think, across northern New England. That's checking what's happening nationally. It's time now for a look at your local forecast.
Well, hello and good morning, Washington. Meteorologist Alex looking here. A little bit of sunshine this morning, but I think we will increase clouds through the afternoon ahead of the next system. Temperatures today in the lower 50s, but dry conditions today. Things will change, though, tomorrow. Rainy and raw the majority of the day. 49 degrees, a little bit of a break on Tuesday, maybe some showers after sunset. Slow warming trend, 58 Tuesday, 61 with more rain likely on Wednesday. More rain to round out the work week and into the start of next weekend as well.
See you next half.
No, you cannot. We've already got one. We're one man down.
One.
Yes. Thank you, Rob. Appreciate it. Let's bring in now Dr. Rich Besser, the head of the